My name is David. I'm into non-profit management, a communications trained person and a professional. And today, because of what has brought us together, we have had to, out of a sense of necessity, come out to ensure everybody is on the same page as far as the awareness of the outbreak of what has become a menace globally is concerned. Yeah.
So, sir, what do you have to say to the general public?
Great. I think from what we have found out, we discovered that the buy-in is very effective, has been effectively created, and the level of awareness is already there. But there's a whole lot that needs to still need to be done. From what we have gathered through today's exercise, more needs to be done in terms of provision of the safety or precautionary materials. For instance, people are more interested in having the hand sanitizers freely given to them, the masks and all that. So what we need to do, yes, we need to do more. The awareness is there, but the provision of those requisite safety and preventive equipment. Yes, that's what we need.
Right.
Everybody should come out. Let's fight it, that we did Ebola, that we defeated the other epidemics that have hit us before. We will still hit this one and defeat as well.
All right. Okay. Have you in any way been able to know about the centers?
Yes, I'm aware the governor of the state, His Excellency Dr. Samuel Otom, visited some of the centers that have been designated as isolation centers for those who have been tested positive for and by my own assessment, I think we are satisfied with that. And much as more still needs to be done, one critical area that we needed to work on, we still need to work on, is towards our level of emergency preparedness. We do not seem to be ready for emergencies, so that when it comes, it kind of takes us aback. So I think both government and all the stakeholders in the project of Nigeria, and as far as global health issues are concerned, needs to come together and ensure that our level of emergency preparedness is improved upon.
Good afternoon.
Please, very doing.
My name is Ukan Kuru. I'm an activist and a humanitarian.
All right, so you're one of the organizers of the sensitization program.
Yeah, I'm one of the board members of the Ngumimi Jebe Foundation.
Okay, so you're out to sensitize the people.
Yes, we're out to sensitize the people on the need to maintain 100% hygiene in this period that we're battling an outbreak called coronavirus, otherwise known as the COVID19.
Okay, so you're out to distribute materials or just...
Yeah, well, first and foremost, we have flyers. We need to tell them the basic things they need to do. Keep safe, wash your hands for at least 20 seconds. Don't shake people, don't hug people, keep a distance, We need to tell them all these basics because a lot of Nigerians are not prepared. Even as we're going around, you basically see that we are not prepared to face this pandemic if it actually hits us now. So we need to sensitize them, to let them know that this is a serious matter. It's not something that anybody should joke with. Our health is very important now because if it affects you, it affects the next person. Somehow it keeps going on and on and on. So that's why we need to tell them. And then we're sanitizing their hands, giving everybody, sanitizers are free, we're giving everybody hand sanitizers, sanitizing their hands at the same time so that they can be safe, at least for those who cannot afford it.
Okay, so you followed this from the beginning to the end.
From the
Would
beginning.
You say it's successful or?
Well, it's successful. At least this is the first of its kind in Makurdi among the CSOs that at least I know. So it's a huge success. We've gone around. The response is quite good. Though a lot of people were not ready, but at least they asked questions while we're interviewing them on the street. So we're impressed. So far, so good.
Going around, we saw that some people were asking questions like, where are the hand sanitizers to be given to them free, like the mask? So what do you have to say about it?
Well, this is just the first of its kind, like I said. We're going to be prepared for it. We just wanted to, first and foremost, sensitize them. We'll have a further plan to see how we can get sanitizers, no matter how little, and the mask, to give it to them. Of course, you know that these things that were very cheap before are far more expensive now. People are making a living out of it. That doesn't stop us from trying to get grants to do what we have to do to save more lives. So it's a one-way thing for us. We're going to do it, but with time. The virus is still growing. It's coming down and going up. So we're going to get what we want. We're going to achieve what we want.
So we are hoping that it should end here.
It should end here. We pray to God. It will. It will. Yeah.
Thank you so much.
Thank you. God bless.
Good morning.
Good morning.
Please, may we know your name?
Okay, I'm Mrs. Yose Blessing from National Orientation Agency.
Wash your hand carefully.
I know you're part of
Coronavirus is real.
that jebe foundation.
Mommy, tell your children to wash your hand before they eat, please.
Yes.
So what is your advice to the people?
Well, my advice to the people is to take preventive measures. Like the government has said, you just have to avoid where crowd is. Then take care of yourself. Make sure, maintain a personal hygiene by washing your hands regularly. Then, no matter how bad it is, no matter how poor you are, just try to have a little hand sanitizer like I have here, so that whenever you have contact with anyone or before you shake anyone, make sure you use it, and after that you use it too. And a lot of vitamin C too will do you a lot of help. Like what I do in the morning, I make sure I take it, I give it to my kids in the afternoon, and even at home, like yesterday what I did, I got a big hand sanitizer. Anyone that comes into my house, before you get to the gate, you sanitize you before you go in. And I think that will do us a lot of help with the help of God. Thank you. Thank you.